The epidural seems like it is just shrouded in mystery, and it does not have to be that way. Getting good information about the epidural can be tricky, and it's extra tricky because usually you don't see the provider who's going to give you the epidural until right before you get it and you're in a ton of pain. So today I wanted to give you some epidural tips so that you know the best time to get it and how it is going to work for you and get rid of the pain that you were having during labor. And in case you haven't met me before, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I've seen thousands of epidurals, in addition to having 3 epidurals of my own. So I really understand this, and I'm excited to give you guys these tips. And if you're thinking, Hillary, send me all the tips, I actually have a whole insider tips series that I'm going to link to down below that gives you even more like secret tips. You can find it down in the description.
All nurses to the nurses station.
Okay, the first one is about timing, and it is that if you get it too early, it can be bad. Now, there are studies out there that show that when you want an epidural is the best time to get an epidural. However, those studies usually don't even start until you're 3 to 4 centimeters, meaning that you are in active labor, which is very different than if you have an epidural and you're just so tired and miserable, that dang Foley bulb. But getting the epidural too early can be problematic. In my time, I've just seen that people who get it when they're 1 to 2 centimeters, especially with those early inductions, tend to end up having a C-section more often. And I'm not sure if it's because that was the way it was always going to be and labor is just more painful for those people based on how baby's positioned, etc. Or if they just got it too early and it restricted their movement, or they didn't prioritize movement well with the epidural, or if there's just something about getting the epidural too early that sort of slows down labor and just makes it not progress as well. So I am here to say that if you really need it, you can still get it. I'm not saying that just because you get an epidural at 1 to 2 centimeters means you're going to have a C-section, but it is something to keep in mind. And if you're getting it early, you need to make sure that you are still promoting movement. I actually have a whole post on my website about using movement, even if you have an epidural. I'm going to link it down below. And honestly, this is one of the main reasons that I think people still need to have a variety of different pain management options under their belt. They need to both know about the medical pain management options, but also the natural pain management options so that they can manage that early labor well on their own before they get an epidural, if an epidural is their plan. I actually have a birth class that goes over both of those really in depth. I'm going to link it down below. Now, on the converse, actually getting your epidural too late can also be bad for a couple of reasons. First off, you have to sit still while they're putting the epidural in. And as you can imagine, if you're writhing in pain, it is really difficult to sit still. And so anesthesiologists don't love to put it on, if you're not able to sit still during the epidural. Of course, the thing that makes it the most hard to sit still with is if the baby is actually coming out while you're getting the epidural placed, which of course means the epidural will not be that helpful. And I'm here to say that if, you're later on, sometimes the epidural just can't catch up with the extreme amount of pain that you have. Yes, it is going to take some of the pain away, but it's not going to take all the amount of pain away that it would have taken away if you had gotten it a little bit earlier. Now, when I'm talking about this, I'm talking about people who are picking to have an epidural like 8 centimeters plus, especially if it's your second plus baby. So something to think about as well. You don't want to get it too early, but you also don't want to get it too late. Again, your nurse can be a really big friend in this. She not only, knows how you're coping with labor, but also like if there's a lineup for epidurals on the unit or if you have C-section scheduled. So if you're planning on an epidural, make sure that you tell your nurse, hey, I would like to get an epidural at the right point. And I still want to promote movement so that she can help you do both of those things. The next tip has to do with right after we put the epidural in. As you can imagine, you are tensed up when you're in a lot of pain. And once, you relax because that pain is gone, your blood pressure can actually go down. This is actually one of the reasons that we give you a bunch of fluid before you get the epidural, but you can actually sense that your blood pressure is starting to tank before we will even see it on the blood pressure cuff. So if you are starting to feel like impending doom, funny taste in your mouth, you start ringing in your ears, things like that, let your nurse know because it's, she can catch up with it really quickly. And there are medications we can give you that counteract this immediately, but we got to know that it's happening. And sometimes the blood pressure cuff just doesn't catch it at the right point. So you be a pro, know this. If you're not feeling well right after the epidural, let your nurse know so she can troubleshoot it right away. Now, my next tip is just like good formal wear. My daughter just went to prom. You got to tailor your epidural to you. And I actually have a whole video on customizing your epidural to you. There's no reason to get an epidural where you can't move at all in the bed, and there are ways to customize it. I'm going to link that video on customizing your epidural down below, but we can adjust it, and I think it's so important, and so many people don't know that. They just go with the standard of whatever the anesthesiologist puts in. So make it work for you, just like a good prom dress. My next tip, and I actually just had a friend text me that her daughter had just gotten the epidural, and it is to get a good nap after you get the epidural. Now, you'll hear me on this channel all the time talking about promoting movement, but sleep, actual sleep, not just sitting there like resting your eyes like my mom used to do, actual sleep where you are getting a nap trumps movement pretty much any day of the week, because your whole body relaxes, and that's the best thing that can help baby descend. So after you get your epidural, plan on getting a nap for an hour, maybe even 2. Tell your nurse, I would love to get a nap after this, so she can kind of coordinate her care, do everything all at once. She's still going to be in the room really frequently, but the good news is you will likely get a catheter in, so you won't be having to get up to the restroom as much. So for a lot of patients, they're like, that is some of the best sleep I've ever had, because they are pain-free and they don't have to pee. So prioritize that nap, because that's really going to help fill up your gas tank and let you really manage the rest of this labor. Finally, after you get an epidural, you might get the shakes. Totally normal. I think it might be due to the cold fluid being so close to your spinal column. But if you get the shakes, one of the things that can help it is to stick your tongue out. Now, one of the things that doesn't help it is just to try and stop yourself from shaking, because you literally can't. So try that tongue out. Know that it is not going to last forever. Even if the tongue out thing doesn't work, it will wear off and you'll feel more comfortable. The more you can just relax and honestly just take the nap, even if you are shaking, it will wear off while you are having that nap. So that will be awesome. Now, shaking is one of the side effects of getting an epidural, but there are a lot of weird side effects that people don't talk about. Again, a lot of this is shrouded in mystery, but I'm here to take off that shroud and show you all the important things you need to know about the epidural. I'm going to link that video about weird side effects up above and down below. But thank you for joining us at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.